Okay. Yeah. So hygiene, bed making, and promoting comfort. Yeah. So our objectives for this topic is to demonstrate how to assess a client to determine their specific hygiene needs and also the amount of assistance needed for hygiene. So when we say hygiene, this would include oral hygiene, denture care, eye care, artificial eyes. No, we could also have patients with those contactments, irrigating the ears. No, if we have patients with hearing aids, we also need to know how to properly care for them. Okay, so demonstrate those nursing interventions used to meet the needs of a client with self-care deficit or facilitate self-care. And then explain the importance of straightening the bed linen several times a day. I think we have already covered that earlier. Yan, why is there a need to keep the linens straightened without any wrinkles? So more likely related to preventing skin injuries related to friction. So explain the importance. Ayun. So let's explain the importance of straightening the bed linens. So other objectives would be to discuss the mechanisms of heat and cold transfer. This will be part of the promoting comfort topic. So explain safety factors of heat and cold therapy. Describe the physiologic effects of local heat and cold applications. And then the different techniques that we can apply when providing care to patients needing moist, dry, heat, and cold. And then, of course, we will apply then the nursing process in all of this intervention. Oh, nandito rin si Angelina. Angelina, will you be going to school today or no? Si Angelina. Ano Yeah, so again those who will be going to school, you may not attend the lecture this afternoon. You are excused. Sige, let's continue. Yeah, so for factors affecting personal hygiene. So I would like you to look at the pictures and you tell me what comes into your mind when you see these pictures in relation to personal hygiene. Okay? Yeah, so let's start with this picture. Yeah, what is the first thing that comes to your mind when you see this? You have to relate it also to hygiene, ha? Personal hygiene. Gian. See, I can see Gian's name on the screen.
First thing that comes to mind is cold water po.
Cold water. Okay. What else? Ano ba na? This is a yes, Loom?
I think the environment.
Environment. Okay. So you look at the picture. It's a timba and a tabo. No, a pail and a water dipper. And anyone, any idea also? Ella, what do you think of? Sorry?
It's for taking a bath.
Taking a bath. No, but when you see tabo, specifically tabo and timba, Bianca, sige Bianca.
Easily contaminated po.
Easily contaminate, very deep naman yung thinking ni Bianca. No, but, di ba, when you see a timba and a tabo, somehow you will associate this with the Filipino culture. Am I right? Kasi in Australia, in the US, they do not have the tabo unless it's a Filipino family. But what would they have would be tissue paper or a bidet. So hygiene is also affected by culture. Okay, so people from some cultures place a high value on personal cleanliness. Sabi nga nila, di ba, with the Filipino culture, we usually take a bath 3-4 times a day. That's how much we value cleanliness. Okay, so unless or sometimes they shower. It depends on the culture. In some cultures, since their environment is very cold, yeah, so what they usually do is not take a bath, but just change, yung clothing. So these things, are factors that could affect the personal hygiene of our patients. Okay, another one. Yan. Palabas na. It's already on the screen, no? So socio-economic class. Yan. So financial resources, which could also define the hygiene options of people that are available to them, could also highly impact their personal hygiene. Even in the Philippines, there are some communities, mga far-flung areas, which still do not have the toilet. What they usually do is just dig a pit on their backyard, and then that is what they usually use as a toilet. And then of course, even in some countries. So another one, spiritual practices. So spiritual practices of people will also affect their perception related to personal hygiene. So in Muslims, they pay particular attention to washing their feet several times a day as part of their religious belief. Another example would be mga Orthodox Jewish, wherein it's a tradition for them to do ritual baths, which is required for women after childbirth and menstruation. So in the Philippines, it's a different belief also. O, di ba, after birth, if you have heard of the practice, mga tradition, they usually do not let the woman to take a bath immediately after birth. Are you familiar with that practice?
Yes.
Maybe mommies na ba tayo dito? Yan. So maybe some of you have heard of that because of the possibility of binat. We have that term in the Philippine language called binat. I don't know if you are familiar with that, especially when you just more so it is used after being sick. Sino yung mga sick last week, no? 'Di ba sabi nila if you do something, a strenuous activity after being sick for a while, the tendency is there will be BNAT, which means you could have no additional symptoms or prolonging of the illness after that. So same thing with the belief on taking bath after childbirth. So it's more of a spiritual or traditional, partly culture practices also. Yan. Another one is the patient's developmental level. Yan. Of course, children learn hygiene practices while growing up. So, however, they are reared, how they are nurtured or taught when it comes to personal hygiene. Yan. And also family practices, it becomes their habits. Okay. And then, of course, the person's health state. Yan. Somehow, it's also affected by the chronicity of illness. What else? If there's any alterations in the mental status, diba? Part of our general survey is to look for the patient's personal hygiene, their appearance, if they look disheveled or what. No? So that would be an indication of their health status. And then lastly, their personal preferences. No, I'm sure everyone can relate. Yan. So this is not to stereotype male, no, but yeah, joke lang. Yan. So his and hers. Our preferences, no. Sometimes, although there are also female, no, who do not usually do a lot of um, personal care kits. Yeah, so again, it depends on the person's preferences. Okay. Yeah, so these are all the factors that could affect, no, the personal hygiene. At the same time, these are also the key things that you need to assess on your patient. Yeah, so speaking of assessment, we have to use again the nursing process for skincare and the personal hygiene of our clients. So as nurses, so please take note of this. You are the role model of good health behaviors. No? So, di ba sabi, you have to practice what you preach. No? So, if you are exhibiting good personal hygiene, and then you will be able to impart that also on your client. Okay, so that's why we always emphasize your proper grooming, you wear appropriate clothing, you wear clean uniform, you know, well pressed, because you are the role model of our patients. Okay, so assessing, so part of the nursing history is to, again, you assess those factors that we have discussed earlier. So these are some questions you can ask your patients. Yeah, so tell me, tell me about your daily and weekly bathing habits. And you can ask the patient to describe what his usual habits are in terms of hygiene, then factors interfering with hygiene practices. So what recently or in the past has interfered with your hygiene practices? Would there be any diseases or sickness, that have stopped you from doing your usual hygiene routines? So sometimes pain could also interfere yung hygiene of the patient, because there's too much pain. Yan. It also limits their movement, so their inability to do self-care. So other factors, so exposure history. So do you sunbathe? How much sun or tanning booth exposure do you get? And so even the use of sunscreen. So these are all also parts of hygiene. Remember, when we deal with hygiene, we are also somehow assessing the skin condition of our patients. Okay, so of course, frequent exposure to sunlight, especially during the critical hours from 10 a.m. to 3 p.m. Yan, especially if the patient would have an increased risk for skin cancer, then we have to explore that. So history of skin or mucous membrane problems. And you could ask what relieve the symptoms. You can use your old card to check. And if they also follow any special hygiene practices. So for the mouth, the feet, the nails. Yeah, so even their perineal care, hair and also piercings. Yeah, so for the physical assessment, we also look at the different organ systems. We don't only focus on the skin, but we can also look at the musculoskeletal system. And so as mentioned, if there is, for example, weakness that could interfere with their ABLs, mga limitations on the movement. And then the skin, you check for cleanliness, the color, texture, and then for the oral cavity, you note for unusual mouth odors, you check the mastication ability of the patients. the swallowing, if there's any presence of dental caries or periodontal disease. Okay. And then for the eyes, ears, and nose, and you check for any tenderness, dryness, if there's edema, bleeding, or any discharge. Then for the hair, nails, and feet, you check for the presence of dandruff or hair loss, pediculosis, and especially on the scalp, nails, and feet for intactness and cleanliness. So per perineal and vaginal areas, you can note for any perineal odors. Okay. So these are some of the nursing diagnoses related to hygiene and self-care. So bathing, self-care deficit. So in your NANDA, if you have tried browsing it, there are also different categories of self-care deficit. Yan. So for example, your patient is post-op. Yan. So there could be post-operative weakness. Yan. So sometimes there is fear that movement can alter yung post-operative site or sometimes the pain itself. So the tendency of your patient is to limit the movement. So I will not take a bath right now. Your patient might be scared of putting stress on the wound site. So same thing with pain. And then there could be ineffective coping related to chronic skin disease, ineffective health maintenance. Yan, so you can just specify what specific area of the body is affected, receiving poor hygiene or care. Impaired oral mucous membrane. Yan, so for patients who are undernourished, so those with dehydration, when you assess the mouth, it could be very dry. And then impaired oral interaction could be related to disturbed body image. So you see the connection of all those diagnoses of those assessments. No? And then imbalanced nutrition, if you're able to assess for stomatitis, and then health-seeking behaviors. So in your book, you can read about these examples as well as the additional related factors. Yeah, let's just look at this one. So for example, you have a patient, 70-year-old man, 5 days after a left thoracotomy. Yeah, so his during your conversation, he mentioned that I don't need a bath, I'm not dirty. Yeah, so there's transient confusion, there's generalized post-op weakness, and your patient is unable to ambulate more than a few steps with assistance of 2 caregivers. Okay, so your subjective data would be the response of the patient. Yan, and then your objective assessments would be yan. So post-operative weakness, inability to ambulate. Okay. Yan. So same thing with the other nursing diagnosis. So painful mouth sores. Yan. And then you would see visible inflammation on the mouth. And then this one is more of a psychological effect. Impaired social interaction. Okay, so once you have identified your assessments and your nursing diagnosis, you are now ready to provide a plan of care to guide your intervention. So some expected outcomes would be verbalize feeling comfortable and clean, participate fully in necessary hygiene measures. Yan, so you take note of this one, participate fully. So as much as possible as nurses, we would like our patients to do independent self-care. No? So we want to try to maximize their ability to participate fully. Okay, because we want to promote patient independence. No, if your patient is able to, for example, brush their teeth, then you let them do the action. Okay, so if your patient is able at least to comb the hair, then you let them do that action. Okay, so aside from promoting independence, that could also be their activity na din, no? Yeah, so it will make them feel good about themselves. Yeah. So you are already meeting yung physical needs of the patient, increasing your activity, even yung combing of the hair could be considered an exercise kasi you are flexing, no? Flexing the joints. Yeah. So emotionally, you are making the patient or you are making the patient feel good about themselves kasi they are experiencing independence. They can do something for themselves. Okay? Yeah, so those are the things that you have to consider. No, kasi sometimes our thinking is we want to help our clients. No, so by help, sometimes we would think na we have to do all the things for them. So that's not right. No, you are actually promoting dependence. Okay, so what you like is patient independence. Okay. Yeah, so there's a thin line between being helpful, no, and then allowing the patient to do things for themselves. Okay. So maintain intact skin and mucous membranes, demonstrate correct skin care measures, and then demonstrate signs of healing in existing lesions. So other outcomes, there are a lot of outcomes pala. Yeah, so exhibit intactness of the oral mucosa, importance of good teeth brushing habits, healthy functioning eyes, ears, and nose. Yeah, so same thing with the cleanliness. Yeah, so if they are using any aids such as hearing aids or the like, so we also have to demonstrate proper use and care for this. Exhibit clean hair, verbalize satisfaction with appearance. Yan. So hair and scalp care is able. Yan. So intact, clean, and manicured nails. Take note na manicured. Yan. Demonstrate intact, clean, and lesion-free foot skins and report reduced or absent nail and foot problems. You might be asking, do we really have to do a manicure, pedicure? No. No, it doesn't mean that you need to bring your cutics and all that. No, especially one example is a nursing home in Australia. So that's also one of the nursing homes we visited last time. They actually have specific services, no, provided for those who are currently admitted in the nursing home. So they have a salon. Yeah, so if the patient needs to have their haircut, no, they can be referred to that department. Okay. Yeah. So part of this also, part of accomplishing these interventions would also be through the help of other departments in the hospital and also other healthcare personnel. Yeah, so you can work hand in hand with licensed practitioners, yan, yung mga LVN and LPNs, no, in the hospital to provide this care for your patient. Okay. So sometimes you also delegate, no, this task. Yeah. So to be able to delegate, we should also know how to perform. No, kasi sometimes you also have to teach them how to properly do these things. Okay. Yeah. So when performing general hygiene measures, again, you always have to confirm with the patient regarding their personal preferences. Okay. So with promoting independence also, you allow them choices. You give them options because that will encourage them to cooperate with you when it comes to their self-care. So if options are available, then you give them options. Okay. Yeah. So one of the interventions that we can do would be providing scheduled hygiene care. So this is individualized according to the patient's personal and cultural preferences. Yeah. So when we say scheduled care, do may morning, afternoon, PM, no PM care. So one example, early morning care. Yeah. So part of the early morning care is washing the hands, the face, no, upon waking up of the patient. Yeah. So we can also provide mouth care. Yan. And we can then assist the patient to the toilet. And so upon waking up. So you can also think of the things, no, that you do upon waking up, aside from getting your cell phones. Yeah, so related to hygiene. Okay. So washing the hands. Then during the morning care, or the AM care, so this is also the time where we assist our clients with toileting, oral care, bathing, back massage. And if they also have special skincare measures, no, you putting lotion, so we can also assist them with that. So hair care, cosmetics, yeah, so positioning. And then you also have to check, no, yung ability of the patient to perform yung self-care. Yeah, so when we say partial, so the patient would need moderate, no, level of assistance. If it is complete care, then you should be, the one to do these interventions to the patient. Okay. Yeah. So again, you still go back or assess, the patient's ability to perform their self-care needs. Okay. So morning care. And then in the afternoon, yeah, so we could assist them with toileting, hand washing, and then oral care. Yeah. So before they go back to bed, we have to help them straighten their bed linens. Yeah. So if they need to mobilize or reposition themselves, we can also do that. Although it doesn't mean na when we say PM care, we only do these things in the afternoon or in the morning. Of course, it would still be as needed by the patient. Okay? She might be thinking, yung straightening of bed linen PM care. So I will wait until the afternoon, no, to straighten the bed. So no, ha? So it would be on as needed basis. But this one would be in general, no, routinely. And then we also have hours of sleep care. Yan. So HS at night. We can continue offering assistance as needed. We can provide back massage to patients. Yeah, so changing any soiled bed linens or clothing, helping them position. And then once they are ready for bed, you place the call light and other objects within easy reach. Okay. And then for the as needed care, any individual hygiene needs. And then if, for example, your patients are diaphoretic, yeah, so they might need more than 2 or 3, no, changes of clothing and bed linen within a shift. Yeah, so some patients would require oral care every 2 hours, or some patients would require an every hour care of the eyes. Yun. So again, it depends on your patient's condition. Okay. Yeah. So any questions so far? Yeah. So this would be our as needed care under walang wifi. Yeah. So under scheduled hygiene needs. Is Francesca here? No, nandito naman siya. Okay. Yeah, so to continue, so helping with bathing and skincare. So the simple act of bathing a patient is a vital and caring intervention. So bathing is a very intimate type of care given to patients. Yeah. So we have to make sure that we are providing privacy and dignity to our patients during this intervention. So some examples of bathing care would be using the shower and tub baths. So you have to check to see that the bathroom is available, clean, and safe. Yeah. So if you are to assist the patient, you have to ensure that necessary articles are available for the patient. And you provide a place for a weak or physically disabled patient to sit in a shower. I think I have a picture here next. Yeah, so you would see, there's a chair, on the shower area. Of course, you have to check the temperature of the water. Yeah, so ensuring privacy. If the patient is able to do yung bathing on their own, then you don't have to stay inside the toilet or the bathroom. You provide them privacy, but you have to make sure that the call bell is ready. So if in case you are needed, then the patient can just press the call bell and then get their attention. Yeah. So if there's a need to help wash other areas of the body, then you ask the patient's permission, or if they would need help. Yeah. So you have a call device, and if you are to be using a bathtub, you help the patient get in and out to prevent slipping. Then keep the bathroom door unlocked. And so these are some examples. You have yung safety call device. So they just need to pull dun sa wire, and then it will immediately get the attention, just like a call bell. Then you have the chair, and you would also see yung safety handrails. So they can hold on to those rails while taking a safety seat. So this one is using shower or tub baths. In some cases, patients are completely immobile. So when, for example, the doctor ordered that the patient must remain in bed, so no bathroom privileges, you would usually see that in the patient's chart. So no bathroom privileges. So it means the patient should remain in bed. Yeah, so all the things that the patient needs to do should be done in their bed or in the bedside. Yeah, so this is what we call a bed bath. So the patient is in bed and then we'll be taking a bath. So do you know Florence Nightingale? I'm sure you know who Florence Nightingale is. Yeah, so the bed bath technique was actually invented by her and then is modified over the years. So literal now, you put the tub in the bed and then you take a bath there. So that is not what is done Yeah. So we are already focused on evidence-based practices. Yeah. So in cases that you need to do a bed bath, you have to remove the top linens from the patient's bed and then replace them with a bath blanket. And so you have to assist the patient who cannot bathe themselves completely. So this bed bath procedure will be discussed yung in detail, step-by-step process later sa last portion. Because you will be doing this at school. This is your next check-offs. I'm not sure because previously, how we do bed baths would be if you have a partner and then you will be doing the bed bath to your partner. Okay, so actual patient care. Yan. But before, that was yung way back, before the pandemic. So last time, what we did would be do the bed bath on the mannequin. Okay, so I still have to confirm do you like to do the bed bath with a partner? Don't worry, you will not be naked. Meron naman damit. Yan. But of course, yung correct practice, how to properly wipe the skin. Yan. So, let's see. Okay. So, with bed baths, we are usually using disposable towels, or a bag bath. Okay, so a bag bath or disposable bath usually comprise of 8 to 10 washcloths that are contained in a plastic bag with a cleanser and warm water. Yeah. So this self-contained bathing system is pre-moistened. Yan. So again, it's disposable. So yeah, just need to use, for example, yung first washcloth will be used to wipe the patient's face. The next washcloth would be for the right arm, then the next washcloth for the left arm until it covers all the entire body. So basically, when we say bed bath, you are wiping, wiping the patient's body. Pinupunasan natin. We are not literally pouring water while the patient is in bed. So, punas-punas. So, it's like also a sponge bath. Okay? Yeah, so the open package is usually warmed in the microwave or stored in a warmer until use. Yeah, so each part of the patient's body is cleansed with a fresh cloth. And so the good thing about this disposable bath is no rinsing is required. So after you wipe the skin surface, you just need to air dry the skin. Okay. Yeah, so you just let it dry for about 30 seconds. And then if there's a need to apply emollient, then we can also do that. Yeah, so it saves a lot of time. Yeah, lesser effort also for the nurse. It's easy to do. And it's also effective. Okay, just like this one. Okay. Yeah. So promoting skin health. So daily use of soap substitutes, topical emollients, and barrier products. Okay, so this one removes, of course, yung dirt from the surface. It also affects the lipids on the skin, making it clean. However, yung very strong type of soap could also cause dryness of the skin. Okay, so you always need to assess the skin. You cleanse the skin when indicated. So ideally, yung no rinse, just like the disposable bath. Yan. And then avoid using soap and hot water And then avoid excessive friction and scrubbing. No, so maybe you are more, if you are doing yung you are not, how English na? Nihilod, no? You are using scrubbing motion when you clean your own skin. No, do not do that. Okay, so it should be one stroke. Okay, so usually it is wipe upwards. No? So that is to promote also yung circulation. Okay, so yung bed bath is not only to provide hygiene, no, it's also a time for you to promote circulation on the patient's extremities. So when you scrub, not like that, huh? So it should be firm, long strokes when you scrub. So you will see that on the video later. Then minimize skin exposure to moisture. Yeah, and then using of skin barriers. So during your bed bath, sometimes it's the only time that you will get access to the patient's back. So you can also provide a back rub. Yeah, so it acts as a general body conditioner and can relieve muscle tension and promote relaxation. But please take note, it is contraindicated for patients who just undergone back surgery or those with fractured ribs. Okay? And I'm sure most of you have experienced yung back massage. You know how
I didn't understand.
you know how it feels, no, right after. Parang you have less stress. It lowers yung anxiety level. Somehow it could improve the sleep quality. Yan. So aside from promoting circulation. Okay, so that would be also the effect, no, of back rub on our patients. Just take note of the contraindication. Okay. Yan. So by the way, additional pala. So during your bed bath, once the patient's back is already exposed, you have to use that time also to assess the skin integrity of the skin. The skin integrity, no, of the sacral area, especially mga bony prominences like the scapula, yan. So the sacrum, the buttocks, and then try to check, no, try to note for any redness on the area because that could be a sign of pressure sore. Okay. Yeah. So other interventions related to bathing. So monitor functional ability. Yeah. So offer hand washing. If you are dealing with children, you can use fun bathing techniques such as the use of dolls or toys, mga rubber duckies. Bathe in water of a comfortable temperature. Ayan, like what I've mentioned, you check the skin condition and then apply ointment to dry areas. Okay. Yeah. So next intervention would be providing oral hygiene. So oral hygiene is imperative to promote the patient's sense of well-being and prevent deterioration of the oral cavity. I think I've mentioned this before during our nutrition assessment. Sometimes when a patient does not have the appetite to eat, yan, sometimes it's not because of their actual disease, no, or condition. Sometimes it could be the oral hygiene. Di ba? Remember or have you experienced, no, when you were sick, sometimes there is unusual taste dun sa mouth. Yeah, so same thing that could be experienced by your patient, no? Because of that unusual taste, that smell, they tend to lose their appetite because of that. Okay, so oral hygiene would be the key, to allow your patient to eat or increase their appetite. So as simple as toothbrushing and flossing and the use of mouthwashes. So use a soft bristled toothbrush, always clean and dry all the brushes between uses. Yeah, so you can assist the patient with flossing and then always clean the tongue also with a brush. So with mouthwashes, this is to help reduce bacteria and then applicable if the cause of the halitosis is for oral hygiene. Kasi there are examples of halitosis wherein it's not actually because of hygiene, but could be because of a disease, no? Or more systemic in nature. So it could be because of a GI problem. Yeah. So if that's the cause, then mouthwashes will offer very little help. Okay, so you have to assess yung root cause of the halitosis. And sometimes yung not only GI, no, but also lung problems. It could also be yung food intake of the patient. And so also related to oral hygiene would be denture care. Yeah. So with denture care, you have to remember not to wrap dentures in toilet tissue. A very common practice among older patients. Now, whenever they remove the denture, diba, they would usually wrap it in a tissue. So the tendency is it might be thrown into the garbage bin because they thought it's just tissue. Yeah. So if they have a container, better put it in a container. When cleaning dentures, of course, we have to put on gloves. Okay, so you wear clean gloves, not necessarily sterile. And then you hold them over the sink. And then you have to place a clean towel o washcloth, no? Dun sa basin, the sink. That is to prevent yung breaking of the denture if accidentally it slips, no, from your hand. Okay. You break it, you pay for it. No? Kaya, yeah, so you prevent that from happening, no? Yeah, so grasp the dentures with a 4x4 piece of gauze. I don't know if this picture has it, no? But ideally, there should be a gauze to prevent also na yung slipping of the denture, and then use cool or lukewarm water to cleanse them. Okay. Yeah. So for the eye care, yeah, so you can use the following techniques when you see adhesions or secretions adhering to the eyelashes. You can wear gloves during the procedure. And so what you can use would just be water, or if you have a normal saline and cotton balls. Yeah, so position the patient on the same side as to the eye to be clean. So for example, you are cleaning the right eye of the patient. The patient should be lying on the right side. Okay, so right eye, right side, left, left. And then how to properly wipe, please remember this one. You wipe from the inner cantos going to the outer cantos of the eye. Okay, so that is to prevent yung cross-contamination. So imagine if the affected eye, no, or yung contaminated eye would be the right eye, yung left okay naman. So no signs of contamination dun sa left. If you will be wiping from the outer, going inside, no, the tendency is you are introducing yung contaminants, the microorganisms from the bad eye to the good eye. Okay? So always when you are dealing with the eyes, inner to outer. Okay? So wipe. And then you use one stroke just like how you clean a wound. No? So one stroke or discard, or you can use the other side of your washcloth. Okay. So apply a warm wet compress to the closed eye for 3 to 5 minutes to loosen the secretions. Yan. So never use soap. Okay. So especially if you are to clean the eye during a bed bath, no? Before you put yung soap, yung liquid soap on your basin, you first start with the face, no? Specifically the eyes. You clean the eyes first with water that does not have soap. Okay, you try to imagine yourself, no? Pag may soap yan, syempre, it could cause inflammation of the eyes. So, mahilam si patient. Okay. So, for patients wearing eyeglass, you clean the eyeglasses over a terry towel. So, that's the what is that? Yung specific cloth or fabric for the eyeglass. You know, the parang satin feel. Yan. So, use warm water and soap. And then dry with the clean soft cotton cloth on a special eyeglass cleaning cloth. Okay, so do not use your uniform to clean the eyeglass of your patient. Do not use paper towel. No? So care of the unconscious patient's eye. So they would require frequent eye care at least every 4 hours. Yeah. So for unconscious patients, of course, yung blinking, di ba? The blinking of the eye actually helps in lubricating, no, and also removes any dirt from the eyes. Kung unconscious yung patient, there's no blinking, the tendency is it could easily dry. Yeah, and therefore you need to put artificial tears and a protective eye shield. So if you will be caring for this type of patients. So frequent eye care. And then for contact lens care, yan, so you perform meticulous hand hygiene and make sure you put on gloves. No, doesn't need to be sterile. Yan, so hard lenses should not be worn for more than 12 to 16 hours. And I think yung hard, I don't know if there are still hard lenses. Siguro those with really poor eye or vision, no? I am more familiar with the soft lenses. Yan. So kapag hard lenses, it should be removed before sleeping. And then for artificial eye care, so this is an example, no? So normal saline or tap water can be used for rinsing. Yan. So the patient should be lying down, you know, so that the prosthesis does not accidentally fall to the floor. Yeah. So you can also flush the socket with normal saline before replacing the prosthesis. Okay. Yeah. So please also read, no? This one is on your book, review the steps. Yeah. So those who are wearing contact lenses, this will be easy for you. No? But those who have not experienced wearing, yeah. So this is how to properly remove and put, no, the contact lenses. Yeah. So what you can do is you try to apply gentle pressure on the lower lid. Yan, and then you pull the outer corner of the eye toward the ear so that it will push yung contact lens outward. Yan. So position the other hand below the lens to receive it. No, if it's a soft contact lens, so same thing. No, you could start by spreading the eyelids and then you put pressure on the lower lids also to push forward the contact lens. Okay. Yan. And then in both procedure, you see that the nurse is wearing a clean gloves. So same thing for this one. May questions ba so far? Wala? Katulog na kayo dyan, ha?
None po.
Kahit so let's move on to providing ear care. Yeah. So with ear care, it's mostly for patients with auditory or hearing aids. No? So also we can apply yung simple cleaning of the ears, yung outside. But if the patient uses a hearing aid, they can check the batteries routinely. Yan, so cleaning the earpieces or ear mold daily with mild soap and water. Okay. Yan. Then for nose care, so please take note of this. No, the best way to clean the nose is you ask the patient to blow it gently. Yan. So as much as possible, we try to avoid yung picking inside because that could damage the nasal mucosa. Yan. So irrigations are usually contraindicated because it could create pressure on the sinuses. So if there's crusting, we can put yung warm moist compress and then yung give or provide disposable paper tissues for nasal secretions. Okay. Yan. So for hair care, yan, so daily brushing of the hair. Yan, so ask permission to braid the hair if you know how to do it. Yan, diba, a patient who is confined in bed for longer periods of time, nagkakaroon ng tangles on the hair. Yan. So one way to prevent that is to braid, no, especially with female patients. Yan. So if prolonged period, then cutting the hair may be necessary. No, but of course, there should be a written consent for that. So during bed bath, you can also include shampooing the patient's hair, just like this one, long hair, si patient. So the nurse uses a protective pad and plastic tray, this one, to prepare for shampooing a patient's hair. Okay, so there is a specific type of basin that can be used for that. Yeah, and you can also use a shampoo cap to clean the patient's hair. Yeah, so with shaving, yeah, you can also assist the patient. And you have to use a shaving cream to ensure that your face will not be affected, or there will not be a break in the skin. Okay, so this one more familiar mga male. Begin if shaving the face, shave with the direction of the hair growth, usually downward, short strokes. So if it's in the legs, you shave against the hair in upward, short strokes. Okay. So for fingernail care, yeah, so you can file the nails to form an oval at the ends. So remove hangnails, you can push cuticles back of the nail with soft and pliable after soaking in warm water. So you can use a blunt instrument or you can clean under the nails with a blunt instrument. An example would be the one I mentioned with hand washing, yung orange wood stick. And then for foot care, I think this is the second to the last. Yeah, so you can use mild soap and tepid water to bathe the feet of the patient. Yeah, so during bed bath, what you can do is after you're done wiping yung legs of the patient, you can ask the patient to soak the foot onto the basin. So same thing with washing the hands. So during bed bath, after wiping yung arms, and then the next would be the hands, you ask the patient to soak the hands directly into the basin. Okay, so after that, you dry the feet thoroughly. If your patient has diabetes, so we have to provide a more meticulous foot care. No, so you always make sure that the feet is dry. Yan, you can apply gauze, no, if there's already a break, no, on the skin. Do not cut off corns and calluses, and then advise them to wear appropriate shoes, no, footwear. Okay. So for the perineal care, so this is performed in a matter of fact and dignified manner. Yeah, so perineal care is not only done during bed bath. No, so this can also be a part of the steps when you insert, for example, a Foley catheter on a patient, or there would be a need to provide medication such as suppository, no, on the organs within the perineum. Okay, so when we provide perineal care for female patients, this is the proper way of doing it. So you have to spread the labia and then move the washcloth from the pubic area toward the anal. Okay, so same principle, no? Cleanest to dirtiest. So we consider the anal area as the most contaminated area. So when we stroke, it should be going to the anal area. So use a clean portion of the washcloth for each stroke. And then rinse the wash area as well with plain water. Okay, so one stroke going down, and then you can use the other side, no, of the washcloth, or if you have a new one, then use the new washcloth. Okay, yeah. So make sure that you also cover the groin. No? For male patient, you have to clean the tip of the penis first. And so using a circular motion, and then move the washcloth in a circular motion from the meatus outward. So from the tip, no, of the meatus using a circular motion. So yung principle earlier would be to in center going outside. Okay, so wash the shaft of the penis using downward strokes towards the pubic area. Yeah, so you can hold yung tip of the penis and then you stroke downwards. And then you rinse the wash area as well with plain water. Yeah. So it's if you are dealing with an uncircumcised male patient, you have to retract the foreskin, no, while washing the penis. Yeah, so after washing, you put it back. No, the foreskin back into place over the glans penis. Okay. Yeah. So always proceed from the least contaminated area to the most contaminated area. So for example, you are doing a bed bath, no, and of course, part of that would be to provide perineal care. So do not assume that you need to do it for your patient. So what you can do is ask the patient. No, so for example, it's a female patient. So ma'am, we also need to wash the perineal area, no, your pubic area. Would you like to do it? No, or would you need assistance? No. Yeah. So you ask muna, no, you ask the patient first. If if the patient is able, then you can provide them with the materials for cleaning, and then you provide privacy. Okay. So if the patient cannot totally do, no, the self-care themselves, then that's the time you do the perineal care. Okay. Okay, is that clear? Okay. So I think this is the last one. So for body piercing care. So perform hand hygiene before providing care. So if you are dealing with this type of patients, it should be cleaned, no, through rinsing it with warm water and a cotton swab. No, so advise patients to avoid use of alcohol, peroxide, and ointments at the site. Yes, if there's an oral piercing, rinse it with an antibacterial, alcohol-free mouthwash. Yeah, so avoid oral tobacco use, and then most piercings usually takes about 6 to 8 weeks to heal, no? Depending on the site also. Yeah, so for the environmental care, yeah, so environment can improve or detract, no, the patient's sense of well-being. So you always make sure that the personal items of the patients are in the bedside stand. Okay, so as much as possible, yung bedside stand, you have to limit, no, getting things from that, because that would be the patient's personal item. So every time that you need to get something from the drawer, you always ask for their permission. Okay. So before leaving the bedside, always get into the habit of saying, is there anything else I can do to make you more comfortable? Okay, so you always need to check, no, communicate with the patient. You try to express that you are genuinely caring for them. Okay, however, of course, you also need to set limits, no, regarding what comfort and hygiene measures can be performed. So always check the patient's ability to do their self-care needs. Okay? Yeah, so always keep this, no, in mind. Always check if your patient is already comfortable. Yan. So for bed safety and comfort, what time is it? 30. So the bed should be in its lowest position. No, we only increase yung height of the bed when you are working. No, diba? You would usually see that on your checkups. Adjust the bed into a comfortable working height. So working height. So meaning you are doing something. That's why it has to be at your level. But once you're done, once you are ready to leave the patient, always put the bed in the lowest position. So that is if in cases of fall, no, accidentally, talagang malikot, no, malikot si patient, keeps on moving on the bed. If ever they will fall, they will not fall hard. Parang iba yun. They will not sustain, no, serious injury once they fall from the bed. Okay, so the bed position is safe for the patient. Make sure that the bed controls are functioning. So when you go to your clinical duty in Makati Med, there are a lot of buttons dun sa bed, no? So they will give you an orientation how to manipulate, no, all those controls. Call light functioning should be within reach. This one, aside from placing it in the lowest position, the side rails of the bed are usually always raised. Okay? And then the wheels or casters are locked. Yeah. So to promote bed comfort, ensure the following before leaving the patient. So there should be no wrinkles. You already know why. The patient feels comfortably warm. If you need to adjust your air conditioning, then you can also help with that. So pressure areas are protected from rough sheets. Yeah. So this one is actually a special bed with air flotation. Yan. So, an advantage would be it decreases yung pressure on bony prominences. But maybe you've also seen yung like an egg crate, no? That's also another type of bed. that could decrease yung development of pressure ulcers. Yeah. So when you teach patients about skincare, so for example, for discharge, si patient and they would like to continue doing mga activities, then you can also impart them, some of those guidelines when it comes to taking care of their skin and ensuring yung proper hygiene is also done. So lastly, for the evaluation, so level of patients' participation in the hygiene program. So eliminate, reduce, or compensate for the factors that we have discussed with the patient's independent, take note, independent execution of hygiene measures. And then changes related to specific skin problems. We would like to improve their skin condition, minimize yung injury, and then prevent skin alterations through hygiene measures. Okay. Yeah. So these are the nursing skills that you need to review for the checkups. So giving a bed bath. Then I think I have also covered some of the critical steps. So when you review, please take note of those highlighted in red, mga critical points yun. And I think I've also covered all those. So how do we, this one on your book, it is not using yung disposable washcloth or disposable bath. This one is the reusable washcloth. So we can prepare at least 2 washcloths. One for the face and the upper extremities and the torso, and then another washcloth could be for the legs and the perineal area. Yeah, so that is how you secure yung washcloth on your hand, just like making a mitt. Okay. Yeah, so you can practice this at home. So straightening the washcloth. Yeah, so you start by wiping the patient's eyes. So same thing, inner canthus going to the outer canthus. Yeah, so then you clean the patient's face, you cover the face, the neck, the back of the ears. That's important. And then the next thing to wash would be the upper extremities. So using long firm strokes, so you wash from the wrist going upwards, also covering the axilla area. Yeah. So after that, you ask the patient to soak yung hands on the basin. So you just continue doing that, on the other side of the arms, and then the next thing to wash should be the lower extremities. The upper torso. So you wash the chest area, next would be the abdomen. Yeah. So then you could start wiping the lower extremity. So same thing, so long firm strokes going upward. So that is to promote circulation. Yeah. So always also cover yung groin area sa singit and also the back of the knee, yung popliteal area. Okay. Yeah. So after the lower extremity, then next would be the back of the patient. Then lastly, yung perineal area. Okay. Yeah. So I would like you to read yung steps, and then also watch the video on how to properly do yung bed bath. So some unexpected situations. So during your bed bath, the patient suddenly becomes chilled during bath. So you check the temperature. So actually, even before you start with the bed bath, you have to adjust yung room temperature. So you can place another blanket if needed. Yeah. So the patient becomes unstable during the bath. You allow the patient to rest. Yeah. So you check the vital signs of the patient, especially mga critically ill. There could be fluctuations on their vital signs. So, yeah. So special considerations, yung removing of the gown. Yeah. So when you remove the gown, you take the gown off the uninvolved arm first. Okay, so you remove the gown without the IV line. And then the last thing to remove, would be from the arm with the IV. Yan. So when replacing the gown, you place the clean gown on the unaffected arm first. Okay, and then thread it over the bottle of the IV tubing and bottle or bag from the inside the arm of the gown of the uninvolved side. When you read it, it's not very easy to imagine, no? So you will appreciate this more once you view the video and once we practice at school. Okay, so never disconnect the IV tubing, to change a gown. Yeah. So you need to practice, you removing and putting on the patient's gown with the IV. Okay, so when bathing an infant or young child, you can have your supplies within easy reach and then never leave the child alone. So always check the temperature before bathing an older patient because they might not be able to tell you if it's too hot. Okay. Yeah. So with oral care, I think this will not be included in the checkups anymore. It's more on the bed bath and the bed making. No, but please do read the steps for the oral. Let me just skip this one. Yeah. So what I would like you to remember, if you are what do you call this? If you are providing oral hygiene to unconscious patients, the position of the head should be on the side. Okay, so that is to prevent aspiration. Okay, dapat medyo side-lying position. Yeah. So another check-off skill for the check-offs would be bed making. So this one, yung making unoccupied and occupied bed. So when we say unoccupied, therefore there is no patient, no lying on the bed. Yeah, so it is usually done if you are getting ready for an admission. Yeah, so you prepare the bed for the patient. So the equipment needed would be flat sheets, one fitted sheet. So when we say fitted, usually this one has the garterized type, of bed sheet. And then you have the draw sheet. The draw sheet is a smaller sheet usually placed just under on top, of your flat sheet. You have your blankets, pillowcases, and then bedside chair. So you also need to review yung steps on how to make an unoccupied bed. Yeah. So this will be better appreciated once we do yung actual practice in school, so but just to give you an overview, so when making an unoccupied bed, you have to follow yung steps on how to properly put each of the sheets onto the bed. Yan. So of course you start by removing yung old bed sheets. Yan. And the next one is you put the bottom sheet over the corners, no, of the head and the foot of the mattress. Okay, so you have to spread, no. So to easily do this, it is better that you work on one side first before you spread, no, the entire bed sheet to the other side. Okay, so some techniques that you also need to practice would be mitering the corners. Yeah, so when we say mitering, yan, it is usually done on the corners of the sheets to ensure that is really secured, no, in place. Yeah. Yeah, so mitering of the corner, putting of the cuffing, cuffing the top linens. And so this is what a draw sheet looks like. So the draw sheet is a smaller type of sheet that is usually placed, no, just underneath the patient, if so that if you need to, for example, reposition the patient, you need to pull the patient to the other side, you just need to pull the draw sheet. No, so you do not need to lift the patient to go to the left or the right side. So yung draw sheet lang, ipupull, and then it will have the patient move to the desired position. Yan. So mitering and then cuffing. And then last procedure here would be yung placing of the pillowcases. Okay. And so some unexpected situations, if the draw sheet, for example, is not available, then you can use a flat sheet. You just need to fold it into a smaller size. Okay, so patient is frequently incontinent of stool, so you can add another protective pad, no, yung under pads aside from the draw sheet. Yeah, so for the occupied bed, basically it's the same steps. It's just that this one has a patient actually on top of the bed. Yan. So aside from ensuring, no, that you secure each of the sheets, you also need to consider yung comfort of the patient while doing it. Okay? Yan. So you have to place a bath blanket. Just to say bath blanket. Yan. So bath blanket over the patient. Yan. So that you will be able to get, no, yung top sheet. Yan. So when you are already placing, yan, so placing each of the top sheets, you use the technique of fan folding. Yan. So when we say fan folding, you know how to, yung paper na fan, you know how it is fold. Yan. So it's like that. So you place the bottom sheet with the center fold in the center of the bed. And so without asking the patient to leave, no, the bed, you will be able to put a new set of linens. No? So same thing, no? Putting on the draw sheet. And then, so last thing to do is you put on the new top sheet on your patient. Yeah, so you need to have your patient cooperate, no, while you are doing your occupied bed, because there will be steps here wherein you need to ask the patient to hold, no, the sheets for you. If your patient is unable, then you can have another nurse, no, to help you with this procedure. Okay. Yeah. So this is just the same unexpected situation. Yeah. Do you have any questions? Let me stop share first. Yan, I think the video is already posted. Let me check. Not yet. So let me stop recording first. No?